Okay, welcome to Rabbi Margo Stein. I am Chaya Lerner, the president of the Rabbinic Pastor Association. These ongoing pastoral education opportunities are for all of us, all the clergy. Rabbi Margo Stein is a licensed mental marriage and family therapist, and she's been working with neurodiversity, and which is prolific as we understand more. So take it away, Rabbi Margo Stein.
Thank you so much, Chaya, and thank you everyone for coming. So today will be a kind of a presentation. I do have slides. I do want to get through a certain amount of material, but I also welcome questions and conversation, and we'll do some case studies together, and we'll have some time for reflection and sharing. So, we'll just dive in, and then we'll sort of take it from there, depending how many people are here and what we think we need. So I'd love to begin with a prayer. This prayer was written by Gabrielle Kaplan-Mayer, and it's a blessing for inclusion. Makor HaChayim, source of life, you created human beings in your image, B'Tselem Elohim. Each one of us a unique creation, genetic material that holds a neshama, a soul that is pure. Our bodies and our minds are diverse creations, full of strengths and vulnerabilities, talents, challenges, abilities, struggles. Some of us born into our bodies needing help to move, to see, to hear, to talk, to eat. Some of us will take our bodies and minds for granted until they change with age, reminding us that there are times when we all need support. The human body is a vessel that we can see, but deeper, what is constant and in common among us all is the unseen, the souls that you have placed within us. Mekor HaChayim, source of life, help us to encounter one another as that pure soul created in your image, that we see ourselves and one another as B'Tselem Elohim. So with that as our setting our tone and our kavanah, that this is about B'Tselem Elohim, I'd like to ask each of us, what is your current comfort level with autism and neurodiversity, whether in your lives or in your practice, kind of where you're coming from. There's, whether it's a personal issue or a professional one, or kind of how you're approaching, and maybe one thing you'd like to get out of our time together. So Patrice, why don't you go ahead?
Okay, so in terms of, I'm not sure what you mean in terms of comfort. You mean like familiarity?
Mm-hmm.
Okay. So yeah, I am aware that there are certain people that I know very well who have, and they're each different types of neurodivergence. So that's partly why I'm here, but also because of my clients, I know that comes up sometimes where I'm wondering. And can you remind me any other?
Something you hope to get out of today?
Oh, okay. Yeah, just having more familiarity, just a deeper understanding. That's all.
Mm-hmm. Okay.
Thanks.
Sylvia?
I'm trained as a child psychiatrist. And so we were always looking at things as a deficit model because that's the medical training model. And so what I'm really looking for is a different lens, because I think that a different lens is really needed. And I've been watching the lenses develop, though I have not necessarily yet incorporated the language. And I know the language is changing. I grew up in an ADHD family. Almost every single one of us has it, including my cousins, my father, my uncles, my siblings, one of my kids, and I have it. So I'm a triple agent, and my professional life in Texas separated autism out from the other part of mental health training and moved it over into MHMR, the mental health mental retardation box. And so those kids were separated off very, very early into their own area but it also meant that those of us who were in mental health training didn't necessarily get to work with them. And so it wasn't until I started working for the military that I began seeing lots of these kids. And they have taught me so much. So I'll stop there.
Thank you. Thank you for that. Hi, Ellen. Good to see you. Welcome. You can come off mute and tell us a little bit about your interest in the topic and what you hope to get out of today.
Hi, everyone. Well, in relation to what you were saying, Sylvia, it reminded me in my social work placement in the early 70s, there was a group of kids who were both autistic or mentally retarded, and they were together, and their parents barely spoke English, so it was a thing with language. My first grandson, Zach, who's almost 27, is quite far along on the spectrum and has had fabulous training and opportunities and all kinds of stuff. And he's very challenging for me. And 2 years ago, I realized that I was on the spectrum through Shir Yaakov, talking about, who's now Shir Miriam. And so I was 77 then. It was a relief about certain things. I mean, I knew that I wasn't neurotypical because I think in pictures, and it had been suggested decades earlier, but I didn't think people could be an empath and autistic, which of course you can. And I spent hours and hours doing self-tests and then didn't do much more with it until a few weeks ago. There have been urgings from inside to find out more about the parts who just work so hard to try to be normal, and how I've been exhausted for 35 years with one immune or autoimmune. And so this is a very wide, big topic for me right now, is having realized that I just kind of said, okay, isn't that cool? You know, but then, because thank God it's Celebrate Neurodiversity now. I've got a big thing on my car. And I love everything you say, Margo, always. So that this is a topic that I'm so like, yeah, I want to know more.
Yeah.
And it's you. I
Yeah.
changed appointments around so I could be here today. So.
Oh, I'm so glad, Ellen. I'm so glad. Ellen and I are in the same community, so we know each other. This is great. And, more people will join us. We may or may not end up getting their stories from them, depending when and, how they come in. But I want to just pop over. I actually want to share this one screen for you, Ellen, and everyone, which is just the defining autistic burnout screen, right? I have this slide in here. It's way down in the thing, but
Oh, wow.
far the most prominent life stressor was masking, or the need to suppress autistic traits or disability, or pretend to be non-autistic. I'll give you the whole slideshow, Ellen. You don't have to worry about copying it or anything. I'll be happy to share. So it feels like that's a good, that is a place of beginning, which is that we do expect people who are different from us to cut it out and stop pretending that they're not like us, or stop not pretending that they're, we just want them to pass for normal. There are books written about this. One of them is, I think, called Passing for Normal, about the stress and difficulty and exhaustion that people feel just trying to get through a day around ableist people. What is the definition of ableism? That was a screenshot I took. Ableism, a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities, and often rests on the assumption that disabled people need to be fixed in one form or another. Right?
Yeah.
So ableism is what loving our own bones, right? Julia Watts-Belzer has that. And I will tell you, Julia Watts-Belzer was interviewed and did a ritualwell.org interview recently. So there's a recorded version of that interview on ritualwell.org. So
Right.
do go avail yourself of that if you're interested in seeing Julia and hearing from her. She's amazing. So what does it mean to be disabled in an ableist society, right? It means that you're at odds every time you leave the house. So what are your options? You can stay in and be isolated, or you can go out and deal with people. And so COVID has changed the calculation quite a bit for people. And a lot of things have been uncovered and discovered by individuals during the isolation that they've experienced in the last 4 years. Things like gender transformations and neurodivergence, things like that have been become more evident to people as they have spent more time in solitude. And remembering that masking isn't something you necessarily do on purpose. It's something you do to get along out there in the world. You steel yourself and you go out there and you like do the best you can. And then you come home and you're exhausted and you don't exactly know why, right? So as we start to put labels on things, we go, well, that's because you were masking. Then someone like Ellen might go, oh, that's why it's so exhausting, right?
Exactly.
Because it is exhausting. That's right. So, as pastoral caregivers and as empathic people and as healers and mental health practitioners, we will come in contact with people who are different from us, who are either neurodivergent or have other differences that are perhaps uncomfortable or out of the realm of our experience. So part of today's conversation is about how to accommodate and include and create a sense of belonging in the spaces in which we are in some kind of leadership role. And then also as a participant, whether it's a family member or community member, how the things that we know and the ways that we are can also help assist and smooth the way so that there's less of a need for people to mask and exhaust themselves by not being who they authentically are, but for us to develop more of the skills around acceptance of differences and around modeling for other people that these differences are just a normal part of human variation and it's really okay, right? It's, the embarrassed mother who shushes her kid because she's afraid he's making a scene, now multiply that or, times 10 or 1,000 or, 10,000 by the autistic kid who's having a meltdown in a public space. There's nothing that can be changed about that by the mother, except she's maybe flooded with shame. Right. And
Margo, is there any way that you could talk about the effect of trauma in relation to autism and ADHD? Because I think that as I'm reading about this, that there's a certain trauma that's happened either genetically, epigenetically, or even in people's lives.
I would love to. That's a great suggestion. And I think what I'll do is I'll circle back to it when I'm going to present some of the slides and give you some of the background stuff. Okay. What I'd love to do to start with is just give you some of the science and some of like where the field is at the moment. And, and then we'll have our conversation kind of along the way. So you'll get these slides so you don't have to worry. You've seen it, you've done it. I was going to tell you a story. This was written by my spouse about our son. Turn and be turned, a mercy, unique and unpredictable. When my son, who has autism, was young, I took him to synagogue on Rosh Hashanah so he could hear the shofar blasts. Listening to the shofar being blown was a physical, sacred, focal point on this high holy day, and I wanted him to feel included in this regal ritual reenactment of the birthday of the world. And I wanted to share these meaningful moments together. As soon as we entered, though, my son said he wanted to leave. It was too loud for him. No sooner had we stepped outside than he saw a guy, my son's honorific title for men on construction vehicles or lawnmowers, mowing the lawn of a building next door. "Mommy, look, a guy," my son beamed as I faintly heard the rabbi call Tekiah Gedola from the synagogue next door. My son ran ahead to the guy. He loved the rhythmic whirls of engines, no matter how loud. Unlike the shrill blasts of the shofar, engine noises soothed and engaged him. Before I knew it, this man got off his seated mower and took my son into the equipment shed. They found a tennis ball, and the two of them began playing catch on the lawn. I had gone to synagogue that morning wanting to share with my son what I anticipated would be a meaningful experience, even a sacred one. Sometimes when I close my eyes on Rosh Hashanah and listen to the shofar, the vibrations of those blasts transport me to a timeless realm into which I meld utterly, somehow touching eternity in the awakening of becoming anew. I had hoped to share something of this sacred experience with my son, to enfold him in this immersive and soulful ancient Jewish experience. It didn't turn out that way exactly. An awakening of a different kind sounded its clarion call, and I was being tuned to an epiphany of another sort, different and yet to me also utterly sacred. The sounds of the ball slicing the air and my son's delighted shouts were as sacred to me as shofar blasts. The lawn we were standing on, though hiding in plain sight, was holy ground. Sometimes we're awakened in expected ways, and sometimes revelation happens off the beaten path with a mercy unique and unpredictable. Towards the beginning of Exodus, we find Moses busy tending sheep when he sees a thorn bush that is burning. He turns aside to look deeply at that bush and sees that it isn't being consumed. God calls to Moses from the bush and says, "Do not come closer. Take your shoes from your feet, for the place on which you stand is holy ground." The Hebrew word for shoe, na'al, in verb form means lock, a lock, na'al. The Hebrew word for foot, regel, contains the same letters used for the word habit. So take your shoes off your feet can also be understood as take the locks off your habits. Sometimes life asks us to unlock our habituated ways so that we can know we stand on the holy ground where sacred encounter occurs. What might you need to unlock today that you might feel the holy ground beneath your feet? What is calling you to awaken? So there are the ordinary times when we have our kid in shul and he runs next door and finds a guy and we find the sacred there. But you as a pastoral caregiver might find specific settings like a terminally ill patient who is a young mother with breast cancer, has 3 children, and one of them is autistic. How would you respond in that situation, right? Does that make you anxious? Do you know what to do? When family gathers to tell you about their recently deceased relative so you can conduct a funeral, and one of the adults present is autistic and has an intellectual disability, how do you reach out to that person? How do you include them in the conversation? You visit a 35-year-old patient in the hospital and you begin to wonder if they are autistic. Certainly you've, in your professional role, may have encountered people in those settings. Your work on a college campus includes several neurodivergent students of varying levels of ability, and you may be unsure how to include them or what they need. You're crafting a baby naming and want to include the autistic older sibling in some meaningful way in the baby naming ceremony. So what do you do? How do you proceed? I've put these here at the beginning of this talk, knowing that we can come back to them as sort of situations that we may have more information about as we get through the next couple slides. But I do want to ask you, how does autism impact emotional processing, right? Because many of the life cycle events and situations where we find ourselves are emotional and intense. So here are some main findings I just want to highlight at the beginning, and we can talk about them again. Feelings of grief and other emotions are still being felt, but the ability to communicate those emotions may be compromised. So if someone isn't communicating them, doesn't mean they're not feeling them. Facial expressions may or may not match the emotional tone that you expect, right? So they will be feeling things, but they may not have the words, and their face may not reflect the emotion that you think would be appropriate in that situation. Overstimulation and emotional dysregulation may impact the way they present. So they may be dealing with turmoil within that is hard to process and to bring toward the exterior. And while they may not meet your expectations, prepare to be surprised by profound experiences. So that's like Miriam's story about our son. Profound experiences are around every corner if we're awake to them. So the DSM-5, which was revised in 2013, so we've had 11 years, but even since it was revised, there's been an evolution in our understanding. So I want to take a quick look at what's in there, and I want to then talk about where we are now. So DSM-5 defines autism as a spectrum disorder. So the APA removed Asperger's as a different diagnosis and introduced the term autistic spectrum disorder, ASD. So that was introduced in 2013. They defined them as levels 1, 2, and 3, which were defined by their support needs, their social communication deficits, and the behaviors that often came with those needs and challenges. I will just highlight the problem with a separate diagnosis for Asperger's is that Hans Asperger was a Nazi doctor, and Hans Asperger separated out the intelligent autistic people, Jews, from the ones with intellectual disability. And he decided the intelligent ones were worth saving, and the ones with intellectual disabilities were not worth saving. And he sent them right on to the gas chambers. And so Asperger's refers to the people who would have been saved by Hans Asperger. So many Asperger's people themselves have decided to do away with that kind of ableist language and continue and prefer to understand it as a spectrum disorder or a spectrum challenge, shall we say. We can even take the word disorder out. So what are the orders? There's at the bottom here, you've got level 1 requiring support. In the middle, you have level 2 requiring substantial support. And at the top, you have level 3 requiring very substantial support. So level 1 is that without supports in place, the deficits in social communication will cause noticeable impairments. Difficulty initiating social interaction, clear examples of atypical or unsuccessful responses to the social overtures of others. They may appear to have decreased interest in social interaction. For example, a person who's able to speak in full sentences and engages in communication, but whose to and fro conversations with others fails, and whose attempt to make friends are odd and typically unsuccessful. So that's how the DSM-5 would call that level 1, who we used to call Asperger's person. Level 2 would need more support. Maybe they also have intellectual disabilities and other co-occurring difficulties. And level 3 might be nonverbal or have others, more severe impairments. I want to introduce the word neuroqueer. Neuroqueer was coined by Nick Walker. He's a queer autistic PhD, professor who talks about these things, and he published this, I think 2011 or something like that. So it's been out for a while. So neuroqueer is defining autism as part of natural human variation, right? We're different neurologically, but we're just queer. We're not impaired, right? So autistic self-advocates consider autism an identity, just as you might be queer or Black or deaf or Jewish. An ableist society, of course, equates difference with inferiority. We talked about what is ableism, right? So a difference from the ableist norm would be inferior. A sufficiently diverse society would be inclusive of all identities and make accommodations for those who can't function as well in ableist settings without support, right? So making accommodations is allowing people with difficulty in those settings to participate fully in those settings. So nothing about us without us means that it's okay to ask people what they need in order to participate more fully, right? It's up to the people involved to know what they need. Or if we're the pastoral caregiver in a setting where there's a family and one of the members is autistic, we might ask the autistic person and we might ask a family member, maybe the primary caregiver of that person. What do they need? How can we meet their needs in this setting, in this situation? So I want to talk for a minute about social cognition. That's what's called the invisible curriculum. It's that social thing that happens between people that many autistic people have quite a difficult time managing. What is it? Which diagnoses indicate differences in social cognition? So you have high functioning autism or Asperger's syndrome, which we're not using clinically anymore. Hyperlexia, which might be a kid who can read at the age of 2, right? And is very hyperlexia, words, very focused on words. PDD-NOS refers to pervasive developmental delays with no other symptoms. And that usually is before you can diagnose something else. Often a kid will get a PDD-NOS diagnosis earlier. Semantic pragmatic disorder has to do with the pragmatics of language and being a little too hyperliteral in their understanding and having difficulty with more idiomatic language. And nonverbal learning disability, which many of us are familiar with, but maybe didn't realize is on the autistic spectrum, which is more of a spatial reasoning deficit where people may have trouble with mathematics or directions, right and left, or riding a bike or other things that have to do with the nonverbal aspects of brain function. But they may be hyperverbal. So there's a whole range of ways that people might present where they are still struggling with the social, or what I call the invisible curriculum. So you may have intellectual disability, but even without intellectual disability, you're going to have something I'm calling splinter skills, because you can do this, but not that. You can do this really well, but not that. So you might be extremely intelligent and you might hyperfixate on a special interest and be able to talk at length on a very arcane subject like dinosaurs or vintage cars or who knows what else. But you may easily miss cues from others. You might consider other people's social needs to be unimportant. You might behave with a tone of superiority toward others. You might be the object of bullying for missing the invisible curriculum. And you may experience distress about the lack of friends or not. You may not. But it is harder for you to make and keep close friendships because the reciprocity and the mirror neurons are functioning differently than they do in a more typical brain or neurology. So I'm going to just go back to pervasive developmental disorders, PDD. You're going to see delays in gross motor and fine motor. You're going to see something called sensory integration dysfunction. The sensory integration dysfunction means your brain is like a traffic jam where all the sensory information is incoming, but it's not being sorted correctly. And so it doesn't come out. It comes in and it just feels like you're in the middle of a very busy intersection. And so it's very hard to know what you're feeling because the processing of incoming and then integrating isn't happening smoothly. It's a more chaotic experience. Attentional regulation, we're talking a lot about ADHD and regulating one's attention. Pragmatic speech, again, understanding speech, understanding intention, receptive language, as well as expressive language. Socialization and missing signals or contextual clues, right? So that's like there's a circle of people talking, circle of teenagers are talking, and they're all on their phones and they're all talking, and the kid that is standing outside that circle has absolutely no idea how to get into that circle of friends talking, no idea. And for other kids, they just come right in and they know how to share, they know how to get people's attention, and they know how to be appropriate. This person doesn't know how to navigate any of those tiny micro movements of social interaction. There are curricula that break that down into 40 different steps so that the person can actually learn what are those 40 steps that it takes for you to break into a circle of teenagers with their phones and practice. Interest in play, affective modulation means your ability to regulate your emotions. And neurocognition, which is theory of mind, is really about my ability as a brain over here to see that you have a brain over there and that your brain over there is thinking about me. So my brain thinking about you, thinking about me, and your ability to think about my brain thinking about you. So that that reciprocity of our minds and the ability to do abstract thinking with each other is very much is not happening in the same way, let's just say, in the autistic brain. There's some mirror neuron deficits, and certainly the theory of mind thing isn't really happening in the same way. All right, do you want to stop here for a little bit? That's a ton of information. Let me just see what the next slide was. All right, we can come back to that. So I hope that's sort of helpful. I just wanted to give you a bit more of the sort of scientific basis and the background so that you can see that there's ways of understanding and dealing with this that is, you know, also based in the science and in the experience, not just in our feelings or in our intuitions. Sylvia, yeah.
I guess the question that came out of that last slide in particular is how to differentiate between what we call ADD, ADHD versus PDD, because so many kids with ADHD also have sensory dysregulation. They have difficulty with being hyperlexic. They have difficulty. I mean, there's so many of those that fit in,
Right.
but they would never have been called or labeled as PDD.
That's right.
And so I'm really wondering about what that crossover is, and then what the lens is that I want to make sure that I'm using, because like sensory dysregulation stuff for me is, when I look at families, it's genetic. I just watch one after another have them, and it gets passed along. And so I don't think of it as being necessarily in one ballpark, for example. So I was just wondering if you could.
But one of the advantages of being a pastoral caregiver is you're more likely to see people in their family system, and you're more likely to encounter the whole group, right? So by encountering the whole group, Sylvia, you're going to notice the genetic similarities between people's, you know, basic neurobiology, let's say, that you're more likely to see that across the generations. And if you were a clinician in private practice, you would not necessarily see the whole family, right? You might see one person. So some of this information is more helpful in terms of collecting information with the one individual that you're going to see. But of course, sometimes we do see one individual, they're the patient, and we go in to see them, and we don't know all these other things, you know, about them. So the question about ADHD is a really important one. I actually have a slide. I'm going to just pop it up here.
Can I just add that one of the things that I've done is doing a life review or a genogram, and you could tell based on the patient or the client's explanation of their family that there might be some things on some people on the autistic spectrum. So that's another way of doing it, is to do if you can't see the family and the family dynamics, is to do a life review
Beautiful.
and
And
attach
as
files.
And if you
working
want,
with kids, there is no such thing as just a kid. I mean, they're always embedded. Even the kids in foster care or
Right.
group care are somehow embedded in something where you get to see a larger context. So
right. I'm just wondering if this one screen is going to be helpful for you. So I'll
Yes.
pull up right now. It's just this. What is the difference between ADHD and autism? So you can see on this slide that with ADHD, you're dealing more with attention, working memory, time blindness, and risky behaviors. So that's actually you're going to see risk-taking behaviors. And you see a kind of a time blindness, or what you see with ADHD is the dysregulation is quite different. It has a different feeling to it than autism, where you'll see more rigidity and routine. You'll see difficulties with verbal communication, which you won't necessarily see with ADHD. You'll see some focusing on like the social rules and how to get things right. You might see some anxiety around change. But this whole column in the middle of this slide is stuff that is overlapping, right? In both cases, you will see difficulties with sensory input, with maybe some OCD, like to deal with anxiety, to manage anxiety by fixating things, some difficulty with interrupting, and certainly with executive dysfunction. You will see a lot of executive functioning issues in both of these sectors. Some impulsivity, rejection sensitivity, maybe some problems with sleeping or eating, repetitive thoughts, restlessness, of course, stimming, and of course, social difficulties go along with both of these. You will see that in both. Yeah. Ellen, you had a question.
Um, it would make sense to me, and I've heard this, I think, that some people who appear to are diagnosed ADHD because it's so much less of a horror diagnosis than autism used to be, seeing only like really extreme cases. That some people who have been diagnosed ADHD are or should are, oh, I'm sorry, I'm having trouble with words, are actually on the spectrum and not ADHD. And so that's a whole question of when does it fall in that middle category. That's a great slide.
So I have a client who is autistic. He has been diagnosed. He is definitely at the level 1. He's intelligent. He's going to college. But boy, his executive function is so impaired. He cannot finish the paper and get the paper into the professor in order to pass the course, right? But he understands everything. He understands all the material, but he can't do the group project where he and 4 other students have to get together and kind of do the lab or do the thing and get it in. He can't do the executive functioning pieces in order to succeed. So one could think he has ADHD because of those particular difficulties, but this is part of his autistic profile. And you know, when you meet him, you realize it's not exactly attention, and he's not bouncing off the rails. He doesn't have that hyperactivity at all. He just can't put the pieces together in order to execute. Right. And so you know, you can get a feeling. I think there's a feeling that I get in I have ADHD, so I kind of recognize it in other people, and I kind of know what that feels like. But the autistic piece has a different vibration for me, you know, on an emotive level, on an intuitive level. But I do believe it's all in a spectrum. I really do. I think we're talking neurodivergence, and that neurodivergence is everyone. Who was it who said, was it you, Chaya, who said neurodivergence? Who isn't? Who isn't neurodivergent? Right? So we all are. We all have brains, and none of our brains are like whatever that typical or whatever that quote unquote normal thing is, because there's no such thing as normal. There is something that's typical, because typical does imply a pretty wide range of what falls into the most common behaviors and functions. So you might be atypical, but whether that becomes dysfunctional, as I've said before, it has to do with where you are, where you're located, right? If you're in an ableist setting, you look more dysfunctional than if you're in a specialized setting where your differences are accommodated and taken into account. Right? So when my kid went to public school, it was a mess. But as soon as he transferred to a school where everyone had an IEP and most of the kids had autism of one level or another, he fit right in, right? And the teachers knew exactly what to do with him, and he was able to learn. But he couldn't learn anything in the public school, right? Because he was such an outlier from the neurotypical student that they didn't know what to do with him.
Such a disadvantage for kids who are in rural poverty areas that just don't have that.
That's right, because there's a
available.
School. Right. There has to be a school that they can go to, right? Or they have to go to an online school, which, as I've said, it causes a lot of anxiety and depression, because being online all the time is just not good for people. I mean, we do need each other, and we are social beings. So even if we have social quote unquote deficits, we still need to be in physical proximity with each other to be healthy, to be well, right? And so the anxiety and depression that people feel when they're not is because it's a human need to be in proximity with other humans. Yeah. So any other thoughts or questions right now? Yeah. Yeah.
Oh, my thought is, when you said that, have there been any research about the COVID, how COVID kind of forced us to be online and not in physical proximity, how that's affecting people's minds and brains and mental health?
Deeply, deeply. There's a crisis, I would say, right now among the certain age groups coming through. People who were online during middle school really struggling now. That is such a formative time for people to be in proximity with each other. that they're just very, very anxious, worried, socially anxious, and really struggling right now to put the pieces together. Yeah. Because, and little kids, I mean, there isn't really an age at which we haven't been affected by this, right? By being isolated for 4 years. It's dramatic. That brings us to the subject of trauma. We could talk about that a little bit now. I mean, there's no question that COVID was a trauma and that the impact is societal, society-wide, that we are seeing a lot of depression, a lot of anxiety. One of the interesting things that we're seeing is, as I said, more gender variance and more neuro variance, neuroqueer behavior, that we are seeing that people in the space of their own privacy are able to explore certain identities more and to actually notice differences more because they're not just masking and fitting in. There's a little bit more space. What has happened is that as people have come back together, they come back different, right, than they were last time they saw people. And so there's an unbelievable amount of stress and anxiety around that, right? Maybe they realized they were non-binary and they're in high school now, and they come back as a non-binary teenager, and their peers may or may not react well to that. Their best friends already know because they're in touch with them, but the kind of wider world doesn't know. And so there's a lot of stress, confusion, bullying, and a lot of social media bullying around pressuring teenagers through social media. So therapists are busy these days, very busy. But you're going to see this. You're going to see this in families. You're going to see this in institutional settings. You're going to see this in hospitals. All the same. The social anxiety and the shame. I would really point at the shame as part of, and a trauma reaction. I want to say a trauma reaction can look like ADHD. And I want to say that is that sometimes a person seems like they have ADHD, and then you take a history from them and you find out that they have trauma in their history. And what it is that the executive functions are impaired by the trauma. And so the trauma prevents them from having a through line from planning and execution, organizing, planning, execution, and delivery. And yeah.
I think when you're talking about a Jewish population post-Holocaust, you're talking about African-American population, you're talking about immigrant populations, you're now talking about intergenerational trauma. And so you have to assume that there's going to be some level of trauma, though it may not necessarily create ADHD, for example. But there are going to be pieces in terms of attention that are going to be the same. I mean, growing up as an African American, my great-grandparents were slaves. So, that ongoing trauma is right there. That goes right through to today. And then I don't know how much we understand yet about how we understand the impact of intergenerational trauma intermingled with ongoing trauma.
Yes.
And then how that affects our behavior. But
yes. So I want to couch that in terms of trauma and resilience, right? Because our focus as healers is on what's the resilience, or how do we find the resilience in the family system in order to help people who have experienced trauma to find their own strengths. So we do sort of strengths-based interventions with people to help them to find whether it's because they have each other, because they can cooperate, because they can co-regulate their nervous systems with each other, because they have splinter skills that we can really, highlight that those are things that can help them move forward in life, or because they can access supports and resources that we can help them find. So that we want to have a kind of a mindset that says, yes, this person had trauma, but that's not sort of where the end of the road for them. What they are resilient. They are resilient human beings. And so our goal here is to help them find their own strengths and make choices. And I would say with people with trauma, the more choice that they have, the better, right? So we don't make decisions for people so much as we try to present options and let people make their own choices, right? And having as much control as possible is sort of like the key thing to know about trauma. If you're not a trauma-informed sort of practitioner, the one thing you really need to know is that giving people choices and not telling them what to do is an extremely, extremely important piece of being trauma informed, right? So that people need to have the freedom to choose.
I think somebody said it so well when they said, don't ask what you can do for me, ask what you can do with me.
Nice. So yeah, so we want to ask people, and that's the same with, by the way, neurodivergent people, which is, what can I do with you? How can I help you? Or what do you need or want in this situation? You know, how can we accommodate or include you in a way that feels good to you? You know, for my kid, when he's on a college campus now, which is a very interesting experience for him. He has an intellectual disability. He'd be what's called level 2 autistic. So he is at Villanova University in their intellectual disability program. And it's a very much of an inclusion program. They have their own classes, but they do a lot of social things with the wider college community. And so he went to the Hillel to see what's up with the Hillel over there, Catholic University. They have a Hillel and they have a rabbinical student who comes periodically. And so we met her and she said, I don't know anything about autism. What do I need to know? What do I need to know about your son? So, you know, she could have come to this workshop and it would have been also good for her to get a wider lens. But the most important thing that she needed to know from my perspective was, my son just wants to be included. He wants to be part of it. He wants to belong. If you're having an event, give him a job. Have him set up the chairs or give out the sidurim or collect the handouts or whatever, help set up the food or clear the food or clean up at the end. He wants to be part of the group, and he may not care at all about whatever the discussion is. That's not his interest. He doesn't care about the topic. He cares about the people who are coming in the room and to make sure they're comfortable and they have what they need. And he would love that job to make sure that happens for them, right? So that just gave her a whole window into what my son is like and what he wants to do. And that was enough for her. Right. So that's part of it. It's like, I loved that she asked me, because that's like what I'm trying to say is ask people. You can say, I don't know exactly what your son or your sister or whoever needs in this setting. Can you help me understand that better? You know, so that I can meet that need or include them in a way that feels right. You know, I was thinking about like the life cycle events, like if you're doing a funeral and there's an autistic family member, that for them, maybe throwing the dirt on the grave because it's so physical, tangible, maybe that is for them the best thing that they can do for mourning. We don't say, oh, we got to protect them from that because they're, you know, impaired in some way. No, maybe that is exactly what they need to do because it's physical, it's immediate, it's emotional, it's powerful. And by shoveling that dirt on that coffin, they can feel their own grief, right? And process it, right? So we don't want to make decisions or choices for people and say, oh, they shouldn't do this or they shouldn't do that. We want to give them choices. They have the power to choose. So those are some of my current thoughts. I want to go back to the question about, so do we have any questions about the social piece or restricted interests? Should I go there or should I skip? So the social,
Whatever.
yeah.
I
So
have a question about trauma. Is there a correlation between Holocaust survivors and the autistic spectrum? Given that trauma, I know that our stress hormone depletes some mothers that were survivors into daughters, but is there a correlation with that? Any chance?
they have never found one that I've seen published or I've seen talked about, but one of my colleagues is Bracha Hollander, who created the Transcending Trauma Project at Council for Relationships in Philadelphia. She's the child of Holocaust survivors, and the Transcending Trauma Project is devoted to all things sort of intergenerational trauma. That's her work, her life's work. And so I certainly will ask her if she's ever heard of any correlation, but I don't think so, because she's never mentioned it to me, and she and I have been working together now for 5 or 6 years. So I would have thought we would have had that conversation. But I will say that intergenerational trauma will cause epigenetic changes in the babies.
Mhm.
Definitely. So what those epigenetic changes are may not manifest as autism, but they may manifest with other difficulties that are congruent with trauma,
We know that they manifest as anxiety.
for sure. Yeah. So intergenerationally, epigenetically, you're going to see anxiety, and you may see executive dysfunction as part of that. Yeah. So, and the whole field of trauma is evolving quickly as well. So, and I would say anyone with autism has experienced some trauma
Mhm.
because of the ableist world in which we live. And so being autistic in that world is traumatic on a pretty regular basis. That's the masking piece, and why the masking is so hard is trying not to get bullied, trying not to get re-traumatized, trying not to get singled out or in some way punished for being different. It's traumatic. So
Mhm.
I would say yes, there's trauma there, and you can expect trauma to be part of it. And being trauma informed in general is helpful because pretty much everyone carries some trauma, even if it's a small t. Not everybody's a capital T trauma, but pretty much everyone has small t trauma from just living in this world, which has been extremely traumatic in the last decade, certainly. So nobody's really scot-free if they've been living in this world,
Mm.
because it's been so challenging. More than a decade, but I would say this last 7 years have been particularly hard for most of us. Yeah. All right. Do you want to take a break? We're like 5 of, and if you want to take a couple minutes, bio break, get something to eat or drink, go to the bathroom, whatever, we can meet back here in about 7 minutes.
Okay, so I'll pause the recording and we can do that. How do we? Okay.
And I just want to say, I actually thought this was an hour. I have someone coming who just left the other side there, not
During that break, I was thinking about Sylvia's comment, and I wanted to say that African American children are diagnosed with ADHD more often and medicated more often than white kids in the same sort of setting. So I just wanted to talk about that pathologizing model versus, sort of working with neurodiversities, is that part of the way that racism shows up is, medicate that kid, make him behave.
As I've worked with so many of these families, I have begun to wonder if actually having ADHD was a biological advantage.
Say more about that.
First off, you have to be really good at functioning while you're moving and being quick on your feet, and be creative. And that the people who couldn't do that were going to be at a distinct disadvantage. And when I look at how you have to be creative as a slave to survive,
Wow.
really requires thinking outside of the box often, and being able to function across sort of crosstalk that is different, where you have to function and talk one way and speak one way here and another way over here.
The code switching piece.
And code switching and being able to move back and forth, as well as being able to, people have told me, like, I'm just tired of being resilient. But how to figure out ways of coping within their own community that's constantly being disrupted by being constantly broken up. So children being taken away from parents, spouses being taken away from each other, as part of the maintaining of this of the system.
Well, the trauma,
So.
I mean, the trauma was so severe. I mean, obviously, that one of the coping mechanisms that you're talking about is that there may have been there's some advantages to that kind of what you're calling resilience. I'm also going to say neurocognitive flexibility, right? Rigidity would not have been an advantage, but flexibility.
Right.
So,
was a tremendous advantage. And if your thinking is always moving in different directions and putting things together differently, which is typical of ADHD or ADD or whatever the heck we want to call it now, it's changed its name, but it's been well described for 2,000 years, because it shows up in Greek medical literature and Greek literature. Then it's what is it about it that is an advantage? And so I really had to find myself thinking about what was so advantageous about that I'm seeing this constantly in so many of these kids, but because our academic and educational institutions are based on being able to sit still.
I know. Right.
And a longer attention span, when that actually may have killed you once upon a time.
Exactly.
Unless you were a fawn hiding in camouflage, then we're working against ourselves. So how do we then, incorporate that?
Right.
As opposed to labeling and mislabeling these kids.
Well, that's it. The labeling and mislabeling of the kids, and then pathologizing their differences and saying that difference needs to be medicated, as opposed to, oh, maybe the way we're teaching needs to be shifted to accommodate learning styles.
And there was also a significant difference in the difference between the rate at which boys versus girls were being diagnosed. So the girls were often being grossly underdiagnosed and never being picked up. So I didn't know I had ADHD until I was trying to figure out what's wrong with, where did this come from in my 2-year-old?
Exactly. It took me till my kid was in 3rd grade before I realized that about myself. Yeah, Patrice. Oh, I can't hear you. Just turn up your volume because you're not on mute. You went away.
1 second.
There you
Can
are.
you hear me?
Yeah, now I can.
Okay. Something weird with like my iPhone is connecting to my Mac. I don't know why. But anyway.
It's the new operating system. They are interchangeable, and now you can, yeah. Anyway.
Okay. Thanks. So, yeah, I was definitely curious about the gifts. Like, are there, like, just how we have qualities that are the challenges of being on the autism spectrum, are there some gifts that are typical of people who are neurotypical? So that's one question. And another thing is, I've seen it described as like more like a patchwork that you can pick out that different qualities rather than a spectrum of, though of course there's that too of like harder to fit into society and needing more support or less. But what do you think about that idea of which I guess is similar to that overlapping ADHD autism thing? And then I even have one other quick question, which is is ADHD considered part of the autism spectrum?
So I don't think that ADHD is considered part of the autism spectrum. They're considered distinct issues, and they can occur in the same person, but they are not considered the same diagnostic label. However, as you can see, the overlap is a lot. That overlap of the Venn diagram shows you that there's quite a lot of overlap. Therefore, if they're co-occurring, that middle ground of things are most likely to be very salient in that person. Yeah. So that, and the other question,
yeah, I know, I'm sorry, I had all these questions at once. What do you, first of all, are there like a bunch of gifts that
yes, right, of course, yes. And that's what I mean by strengths-based approaches to people who are in these categories, which is that we do want to have a strengths-based approach, and we do want to see with each person what their gifts are. And the gifts are going to be different, and we can't assume that everybody with autism is good at math, because that is not the case. However, will you find math geniuses with autism? Absolutely. Computer geniuses with autism? Absolutely. Like, where there's something about the autistic brain that is very, very good at pattern recognition. And so pattern recognition was a secret weapon of the US military during World War II, right? Using autistic people to recognize patterns before there were computers to do that. Because many autistic people have brains that can function quickly and recognize patterns in a way that normally most people are unable to see or are very distracted by other things. So that might be an example of a small percentage of people who have that particular gift.
I wonder if there's a resource where there's a list of like typical gifts, and I know it's going to be different for each person, but okay, I was just curious about that.
I even wouldn't want to pin it down. I would sort of want to meet the situation and to know in my
Sure.
background that there are many. My son, who is intellectually disabled, has a gift for people. He just loves being around people. He loves connecting with people. Ellen is nodding her head. She knows him. He's like a very people person, and that's like his interest. He's much more interested in being with people and knowing things about them than in anything like pattern recognition or anything abstract. He's not an abstract, so each and even pattern recognition can be very concrete and not abstract, as I want to say. So yeah, I just let me grab Ellen's comment, and then we'll come back to your question, to the rest of your questions, Patrice.
Thanks.
I can't hear you, Ellen. I think you're on mute.
Part of why this has been so amazing is a lot of information that I didn't even know to look for. But the thing that I'm most amazed at is, I mean, it's not that I haven't read anything or, tuned in like to this last week on the Jewish Learning Venture. Somehow the term masking passed me by. I didn't have a word for it. I've been saying, stuff without the word that I didn't know how much it was based on masking.
Mm-hmm.
And it's partly that I've done so much work with releasing a lot of trauma, but it's like, anyway, I just want to say it's amazing when a particular word doesn't register. You don't see it, and then all of a sudden it's there in its fullness with like, oh, right on time, because I would have challenged it if I had known it was masking.
Mm-hmm.
But it's all of my physical ills and stuff. Now I have a place to explore. So I really want to thank you.
Oh yeah. And this whole issue of masking and of getting along with people, as I say, it's contextual. So like when you're alone, you don't have to do it, but when you're with them, you do. So it's the stresses of being out with others. Oh, you're still on mute. You're again on mute.
I'm not sure I wasn't also doing it when I was alone, because it was so much the way everything was set up.
Yeah.
So lots to explore.
A longer conversation for sure. And I look forward to that. Yes. So all of that is, as we learn to understand ourselves in our own diversities, right? We also are making space for other people to have their differences. So part of this exploration of autism and neurodivergence is to understand how do we fit into that puzzle. And part of it is to say, how do we help others fit into our situations or our settings where we may have some ability to influence what's happening in that room. And when we do have ability to influence what's happening in the room, how do we make sure that our influence is a positive one? You know, so that's part of what I want to bring up. Patrice, do you have more questions that you want to ask right now? Do you want to have a little bit more didactic stuff I want to go back to, but then we'll come back to more conversation. So you want to ask some now?
It's not really, it's just I was wondering if you have any self-tests to recommend, which you could talk about later if you want.
Yeah, and Ellen may have some because she said she's been doing a lot of those self-tests.
Okay.
One of the sources that I love is Attitude Magazine, ADDITUDE mag.org. Attitude Magazine is basically an ADD. That's why it's called Attitude with two ADD. But they have lots of autistic resources and lots of like intersectionalities of autism and ADD and other kinds of morbidity, what they call comorbidities. So try Attitude Mag for that, and also we can email Ellen and ask her some of the places where she's been finding self-tests.
Great, thank you.
That's helpful. Okay, any other comments or questions at the moment? Okay, let's go dive back in for a minute, because there are a couple things that we didn't get to that I think are worth mentioning. Okay. I started to talk a little bit about intersectionalities. In this case, I want to talk about autism and gender. We want to bust some of the myths and assumptions, right? So we have an assumption or a myth that most autistic people are white, male, and young, and that they're usually diagnosed as children. DX is diagnosed. So would you, therefore, with that assumption, would you miss the autistic traits of a Black, adult, assigned female at birth person who identifies as non-binary, right? And you see them in the setting and you don't realize they're autistic because they just don't fit the profile, right? So we want to also open up who has autism, who might be on the spectrum, and we don't want to miss them. Would you miss the gender dysphoria of an autistic child who dresses and behaves in cross-gendered ways because you thought this was autistic behavior? Right? So are we attributing behaviors to autism or to gender? Are we getting them mixed up? These are intersectionalities, so we are likely to come in with our own preconceived notions of what is something and what isn't something. And so really this is just a kind of a wake-up moment, a wake-up slide to just say, you know what, there's differences. And so we need to take people in the moment and also keep our minds open to the fact that something else might be going on than the thing we thought. Autism and trans identities frequently overlap. So what this says, this pink writing, it says, such a huge proportion of the autistic community identifies as trans, genderqueer, non-binary, or genderless. I've started referring to myself as gender vague, referring to a specifically neurodivergent experience of transgender identity. Gender mostly impacts our lives when projected onto us through other people's assumptions. Being autistic doesn't cause my gender identity, but it's related to how I understand and experience gender. Autistic people's brains are fundamentally different. We can't make heads or tails of the nonsensical characteristics expected of womanhood and manhood. I love that. I love that because the nonsensical characteristics of womanhood and manhood it's so important for us to realize that the assumptions that we have been socialized into are just a construct. And if you don't receive that construct or you don't internalize it, you are not going to show up in the way that other people expect you to. And so why you didn't internalize it might be because you're gender vague or non-binary, or it might be just that you just don't buy it. Whatever it is that people are telling you you have to be, you're like, that's not me. I'm not buying that. So I think that's a lesson for all of us. This is a place where we could all actually benefit from that questioning of gender as a construct that we need to conform to after the when the pandemic started easing restrictions and we started coming back into public spaces with each other. I had to go to something And I remember saying to Julie Greenberg, who you probably know, Julie, I remember saying to her, she caught me coming out of like a nail salon or something. And I was like, yes, it's so much work to perform my gender. I had completely forgotten how much work it was, to perform the female gender is like a heck of a lot of work. And I was just like, I had just left it behind and I loved, and this is my own experience as a person who has no problem identifying as a female and is comfortable in that skin. I still felt like performing my gender was just too much work. It was just like, why is it so much work? That is ridiculous. You know what I mean?
I'm laughing in part because I always thought it was stupid. And I remember experimenting a little bit in the 60s in middle school because I had to walk through the 5 and dime store to shortcut my way home from school. And so I bought Yardley. Remember Yardley, the British influence? And then I went, this is really dumb. Why do we have to paint ourselves?
Right.
I'm not going to do this.
Right. So all of that augmentation, all of that pressure to highlight, I love trans women. They do their femininity with so much, many of them do their femininity with like so much joy and so much glee because they get to paint their nails and do their hair and become hyper feminine. But most cisgendered women are like, not most, but are in our communities are like, wow, that's really not me at all. So my friend who's in Florida, who's coming to Florida, I told you she's a trans woman and she's a Torah scholar. So she's not a flamboyant female by any stretch, but boy, does she love having those gel nails. She loves having her nails done, right? And her wig is just, she wears a wig because she's from the Orthodox community and it's just so, and we gave her a gift. We gave her one of my mother-in-law's scarves. They were like really beautiful. And she's like, wears it everywhere. She's like, got her scarf, and I love that she's appreciating it more than the cisgendered women who live in this house would be doing, right? She loves this beautiful object. So I'm just saying that the trans thing is its own, version of femininity that I think is also very powerful and it's precious to me that they have that, that my friend has the freedom to express herself that way. And I want her to, but I don't want to. And I do think that's part of what we're talking about. Yeah.
So
Yeah.
I appreciate the idea of gender vagueness because I always thought of myself not necessarily as male or female, but as vague, as just human. How can I be a human being? And all this stuff about, I used to go to the nail salon and color my hair and all that stuff. And I said, why am I doing this? I have no desire to do that. I like wearing Lands' End men's clothes because I like it. I have this preppy need to be preppy. And I don't quite understand trans women who want to transition, because as you get older and you have the hormonal stuff, it's like hot flashes, not something I enjoy doing, so I don't know, because under hate, you do it, I don't want to deal with it. But I appreciate the idea that there's a gender vagueness that people have. Thank you.
Yeah, and that non-binary space is getting bigger, right? We are becoming much more comfortable with people. The people are essentially, we're all in a gender spectrum. It's impossible not to be. We're born in a human body. It's on a gender spectrum. Back in like the 70s, I think there was a treatise about how there are 5 genders. So that idea has been around for 50 years, that there's not just 2, right?
Actually, there's 6 genders in the Talmud. They knew it in the first century that there were more than just binary.
Yeah, we are not non-binary. We do think that we're binary. We tend to think we're male or female, but right, if you think about that, those are really the hyperpolarities, and most people are somewhere in between. Very few people are very much near, at the very end of that polarity. And I would say the same thing is true about neurodivergence, is that there's, neurodivergence. It's a big, big umbrella, and there's lots of ways of showing up inside of that big umbrella. And the things that we're learning, or the things that we know about inclusion and belonging and B'Tselem Elohim, being in the image of God, and of treating people with the kind of dignity and respect those things apply across the board anyway to everybody. But the reason that I felt this conversation was so important is that people get afraid when they are confronted with something they don't understand. That is as true of a trans person standing in front of you that you feel you don't understand as it is of an autistic person standing in front of you that you don't understand. Right? And so really what we're trying to do is demystify these things so that when we are in the human encounter, we see them as B'Tselem Elohim and are treating them with curiosity and respect, and with a kind of open-hearted empathy that is our stock and trade, all of us, and that is in fact what's needed, right? There's no special magic thing you do. There's human empathy and compassion. And just to demystify the category so that it becomes one more place where we can function as fully human, fully compassionate healers. Right. So that's kind of my goal, I think. Does that comport with your goal? Yeah. Okay.
I was
So-
going to say, I think the more that we can understand others
Mhm.
and understand the parts of ourselves that we've not explored, really helps us, at least in our cultural context. It's more difficult when we have to cross cultures because we haven't learned the language at our mother's knees that they have. And boy, that came home to me when I worked in New Zealand, because we were speaking English. We were not speaking the same language. And it was such a struggle to understand what mothers and kids were telling me about their kids' behaviors in school, when they would say, well, he was just a wee bit naughty, which meant he'd been expelled. And so having had to work in cross-cultural contexts, that is so hard. And I don't think we always recognize when we're hitting a cross-cultural context in our own country, in our own region, and in our own domains, even sometimes.
Well, the difficulty of communicating across domains is part of what is heightened into sharp relief with the autistic person, right? Because within many autistic people will tell you that fellow autistic people, and they understand each other just fine. They are totally comfortable and fine in their social groupings with each other. They're like, not a problem. It's really trying to talk to the neurotypical person where a lot of this anxiety arises. And that's why having my son in a special needs school was an advantage for him, right? He didn't grow up hating himself and feeling bullied and feeling, inadequate all the time. He grew up feeling like the mayor. He can talk to everybody. He knows everything about everybody. He's social. It's really important. Context is everything. Yeah. Okay, there's one more little topic that I want to talk about. Let's see if we can get that one up. So this one is behavioral health. In a way, people's behavior, sometimes autistic behavior is a quote unquote problem, right? And it's something that has to be managed by the family. So you come into a setting and there's an autistic, kid who's acting out, or there's an autistic adult who's, maybe having a meltdown and it feels completely inappropriate, or maybe they're interrupting a lot and it feels really hard for you to conduct the interview to get ready for the funeral, or whatever. So I wanted to just really put a note here that all behaviors are functional. All behaviors have a reason. Behaviors happen and they're maintained for a reason. So there's no such thing as a manipulative kid. They are doing the thing that works and it serves the purpose, and it's up to us to figure out what is the purpose. So why is this behavior happening? What is the purpose? Is it a sensory need that the kid has, that they're uncomfortable? Is it the need to escape because something psychological is happening that they need to get away from? Is it attention-seeking behavior? They need more reinforcement, more validation, more attention. Is there something tangible happening, like maybe a medical issue or something uncomfortable, or maybe they're hungry, or maybe there's something actually happening in the physical realm that needs attention? But it's not a manipulation, right? It's an expression of a need. It's just that the way that need gets expressed is considered inappropriate by everyone else, or what I would call the ableist society. Expectations is that you need to behave this way. You need to sit down in your seat and listen, and the teacher will teach you. As you said, that can be a totally unrealistic thing. And so those behaviors are completely predictable in that setting, because the setting is set up for failure for people for whom they cannot sit in a seat and attend at great length. I want to read this to you. This is inspired by the Shema, to listen, by Neil Katz. He's an autistic person, and he wrote this. I cannot speak. For whatever reason, God has intended for me to be mute. Many people might believe that I cannot think, but despite their thinking, I can. What's more is that I listen. A lot of people may stare at me, and when they do, I listen to their body movements and eye gaze. I listen to their ignorance. I listen because I have no choice but to take in the world in the way that I can. Listening is different from hearing. When you hear someone, you simply recognize that they are emoting sounds. When you listen to someone, you actually process what they're saying and internalize it. What do I think of the people who stare? Let's break it down. What they are saying is that they are unsure of me. They can't quite figure me out and don't know how to categorize me. They're saying I am not the way they are, that something's not right. Now, for the second part, how I internalize it. I used to have some issues with this. I used to believe the stares, and I thought there was something wrong with me. I used to get down on myself for not fitting in. Now I'm much more confident in myself and my diagnosis. I'm an advocate for autism awareness, an emissary, if you will. I welcome the stares, and I wish people would actually ask, what's different about you? I've internalized that some people are uninformed, not knowledgeable about special needs, and need to learn about neurological differences. I don't take it personally anymore. I've listened enough. It's time for me to speak, however it may sound, through an electronic device, my hands, or my mouth. Now it's your time to listen. Are you ready? And then, we said that right before the Shema, the Shabbat, that we were celebrating Jewish Disabilities Awareness and Inclusion Month. And then we said the Shema, and it was really, really beautiful, right? To really wake up our ears in a different way. And then to think about, this is inspired by the Shema. So this is really about who's listening, right? And what are we listening to? And are we listening to each other in the deepest possible way? And I think as pastoral caregivers, that is such a big part of what we're about, right? Is that listening. So this, I feel, is helpful in terms of how to listen. I want to say a word or two about co-regulation of the nervous system. So people co-regulate with each other. They respond to each other's emotional state. So if you're in a room, if someone's next to you who's anxious and fearful, you're going to feel that, right? Because anxiety and fear are contagious. But staying calm and well-regulated in yourself is your best response to this and most stressful situations. And how do you do that? I hope that you've been working with mindfulness. I hope that you've been working on a mindfulness practice that helps you stay regulated when people around you are dysregulated. And I want to introduce the phrase unconditional positive regard. Unconditional positive regard is your ability to meet the person in front of you with an open curiosity and acceptance, no matter what is being offered. So unconditional positive regard is extremely important all the time, but certainly in settings where emotions run high, and certainly in settings where people are stressed, and certainly in settings where someone may be socially unacceptable, right? Because you're continuing to be able to maintain that unconditional positive regard for the person who is breaking the rules or the taboos is really going to help everybody else know what to do. It's really going to help that anxious mother not worry so much that her child is acting out, right? Because you're fine with it. And if you're fine with it, you're modeling that it's fine for the kid to be a kid and to be themselves and to have the nervous system that they have. And they don't need to change for you, right? So that's unconditional positive regard. And again, how do we do that? That's a whole other course. It's called mindfulness, and we, I recommend it. But that's our job, is right. How do we practice our own mindfulness so that we can show up that way for other people? Inclusion is providing structural and emotional accommodation so that other people can feel fully included. So even if an autistic person struggles to express how they feel, you should be trusting that they are feeling and processing in their own way. They may not look at you, they may not speak, they may not put it into words, like I said, their face may have the wrong affect according to your view of how they should be feeling right now. But you should trust that they are processing it in their own way, and that is what's happening, and your unconditional positive regard will allow that to continue. Concrete instructions, laying out a roadmap, these are very helpful. So this is a funeral, this is what's going to happen. When we get to this point, you can do this, or when we're at this point, you might want to do that. Do you want to help carry the coffin? Do you want to, we're going to talk it through. We're going to create a roadmap, and we're going to know who you are in this and what your role is, so that you know where you are supposed to land. That concreteness will help that person. Again, physicality, concreteness, physicality. So putting dirt on the grave of the deceased, as I had mentioned before, these are helpful because they're tangible, they're physical, they're specific, they're concrete. And that belonging is the most important thing. You are part of this, you are part of us, you are part of this experience, your experience matters. And finally, anything familiar, music, ritual, or family members who are there to help them with their processing, and to be sure to keep asking, what's needed here? What can I do differently? Or what should we include here to make this person feel most included? Those are kind of just like bullet points. I think each one is sort of a larger conversation. Happy to unpack it. But now I'm going to return to our original question, which is, where in specific events, or where in your life, since there's just a couple of us here, we can say, and just take the time. I'm going to come off screen share. I don't know if you want these examples or not, but coming off screen share and just saying that there are situations maybe in your life where you've had these questions about an autistic person in the room and what might be the best way to handle it. Or we could take some of these case studies, these theoreticals that I jotted down. Do you want to offer up anything, or do you want to start with some of the ones that I was thinking of?
I would imagine that, any Jewish ritual like but mitzvahs or Torah, that you could do some practical things with someone who's autistic in the family, like dressing the Torah or parading the Torah, something like that, something practical. But how would you, if let's say this person wants to do a bar mitzvah, how would you work with that person?
So I have done that a lot. I have done a lot of B'nai Mitzvah with autistic kids, and that's how I got started in this whole field. Was I had an autistic kid, and I started working with other people's autistic kids. So I would say that, first of all, we work with the parents as well as the rabbi or the tutor or the community, who are the stakeholders in a bar mitzvah, right? The parents, the kid, the parents, the larger family, the community, the education director, or whatever's the norm in that particular community, and the rabbinic presence. So basically, we're going to craft a very unique ceremony that's going to help this child achieve their sense of success and achievement, and the sense of launching them into whatever's the next phase of their development. So it does not have to conform to what a typical kid might be able to do. Maybe this person has difficulty reading and deciphering Hebrew, but maybe they can learn by ear. And so they learn 3 psukim and they're able to chant from the Torah with somebody following along with the yad in the script, in the actual text, and they just know it by heart. Or maybe they can read it if it's on an enlarged Xerox because it's color coded. So we put the enlarged Xerox right on top of the Torah scroll there so that they can read it the way that they can read it. These kinds of accommodations feel very important and basic in terms of giving access to Torah reading. But then there's bigger questions. Can they lead part of the service? Well, it depends. Are they musical? Do they come in through music? Is there something they want to do that's musical? If they are musical or if they love music and they want to co-lead things, then let's start with what they already know and let's build on that into what else they could do. And then in terms of a Devar Torah, are they capable, if they are capable of writing something and actually delivering it, that's great. That's what a typical kid is expected to do. But often as not, that's not within their grasp. So in the case of my son, his godfather and he worked together to create a series of cards with questions on them, and they created a conversation. And so his Devar Torah was a conversation. And so, his godfather would ask him the question, the card was in front of them. They both knew what the conversation was going to be about. And then he had practiced his responses, and his response was still spontaneous. And in the moment, it wasn't pre-scripted, but it was something he had practiced so he could discuss the Torah portion with, as a kind of a conversation. And it was very moving, actually. It worked out really well. And then we wrote a song at the end, and then we all sang the song, for his Torah portion, which happened to be Noach. So it was very easy to do that. Because it wasn't like Tazria Mitzora or something like that. It was Noah. But it's great because he was able to really engage with the topic and his love of animals, and he did his mitzvah project around that. And with other kids, I've had them, again, we've adapted the amount of intellectual stuff they've needed to do if they have an intellectual disability. If they're very shy and they're not going to sing, then we've had other things happen. Maybe we have close relatives read with them and they're reading together. And certainly the Devar Torah can take any number of forms depending on what the child is able to do in terms of presenting some kind of understanding of what's happening in the Torah portion. And it doesn't have to conform. So I guess really it's about creativity. It's about working with expectations. It's about working with the parents so that they don't put expectations on their child of you have to do it this way or that way, and helping the parents. Sometimes there's a little bit of grieving that the parents have to do, that their kid is not able to do the thing that they had in their head that they wanted their kid to do. And so they might have some grief work around that. And that's okay. That's important. We give space for that. And then we really try that when that day finally comes, that it's such a pure celebration, such a pure joy of what, again, strengths-based of what the child can do and does do. So we're very strengths-based, I think, in the bar mitzvah setting. As you might know, Goldie Milgram has done brilliant work around B mitzvah. And so she has that online, B mitzvah, if that's a resource that you want in your life.
Great.
Yeah.
Thank you.
Yeah, so that's one specific example. What about hospital visits? Have you done much of that, or what about other life cycle events?
All of my hospital visits were done at a skilled nursing facility where everybody who lived in this retirement community is already over 60. And so what I found to be the most challenging was how the staff treated the patients. Because I watched them infantilizing them. And I call them residents rather than patients, because they were residents. And so that was what I struggled with the most, was how unaware they were of that. If you walk up to somebody who's sitting down and you're standing up and then you rub the top of their head, their child.
Mhm.
And I sure hope that they weren't like Southeast Pacific where it's taboo, or Southwest Pacific where it's taboo, because that's where the ancestors reside. I mean, like,
It's presumptuous.
and then how to respond to that as a student. When I knew that my observations were probably not welcome.
Mm. Right, because you were upending the system by noticing things they were doing that were not respectful.
Yeah.
Yeah. I have a friend whose mother lives in a memory care unit, and I see that mom fairly often. And I'm always watching the staff to see how's the staff treating all of these people with very clear memory impairments. You know, it's a locked floor. And the people can't wander off, but now they're there. So what's happening? Yeah. It's frightening. Yeah. Yeah. It's a good point. And also like this kind of training, like this kind of empathy and compassion and coming from a strengths-based perspective and a person-centered perspective, right? Not pathologizing people, but actually seeing them as a, you know, B'Tselem Elohim in the image of God and as able, having many abilities, and just the ones that we're labeling as disabilities are impairing them in terms of functioning with everybody else, but they aren't necessarily experiencing that as disability on their own terms, right? And so, but then other people judge them and infantilize them, right? So it's super challenging. You're right on. And I think that's part of what we're talking about this, so that we can be sure that we are the people that are bringing something different to the table. You know, on Thursday, I'm giving another talk as it happens, because I guess it's just feels like it's up right now. And this talk is to the clinical staff where I work about autism in the therapy room. So instead of worrying about the Jewish piece and the pastoral pieces, we'll be talking about the clinical pieces around recognizing autism and treating. But you know what? The principles are the same, right? How is it different? Principle the same, right? Treating the person with dignity and respect, with unconditional positive regard, with understanding that behaviorally they may be having issues, but you know, your job is to be completely spacious around that and compassionate and treat that person always with the dignity that they deserve and respect. Right? So how is it different really? Except there may be a few changes in terms of what you advise or what you recommend or resources you can access, things like that. You know, in the slideshow that I give you, I will have a list of tools and resources. So you'll have some of that. Just things that you might need to know. Some of them are Pennsylvania specific, but in your state, they'll have the same. Like if you want to direct people to Office of Disability Services or to the vocational services or anything like that, those things are run by state, but you can access them through for your state. They're all available online, and you can help people access resources.
Good.
Yeah. Yeah. And there's games, there's card decks, there's board games, there's stuff you can do with people that are helping them to name their emotions. There's a emotion wheel, there's an emotion scale that's for younger kids, and then the emotion wheel, which is very complex. But you can really help people to access and identify their emotions with various tools. I was thinking about the emotion wheel, which is it's kind of complicated looking, but I was thinking, well, maybe I'll see if someone on Etsy could turn that into a pillow for me. And then I'd have the emotion wheel on a pillow and I could have it in my office and then we could just use it. I think I might do that.
Into a keychain. I saw
That's-
that on Facebook.
So, you know, things like that. Yeah. And I think the last thing that I had on the slide when we were looking at, you know, so you're working in these different settings and basically the word ask comes up often, right? You should ask. Like, you don't have to know everything. It may feel awkward or it may feel like, oh, I should know this. Better to err on the side of asking, you know, let me ask this person or this person's family member, what I should do here. You know, coming back for me to that college campus chaplain, and that she just asked. I love that. That made me feel so much better as a mother. You know, oh, I really like Rafi. I really want to include him. What do you think would work for him? It's like, oh yeah, okay. You know, so it's like one of those lessons. The other thing is that I learn so much from autistic people every time, every encounter. And I think that's part of it, is to expect surprise. The quote that my son has given that has been repeated the most by I can't tell you how many people, the quote is this: you always never know. You always never know. So you always never know, and you're always going to learn something, and you really always never know what's going to happen next. And, you know, part of that, what that says to me is like just being open to the unexpected and being spacious enough to see it and recognize it and include it in whatever's happening. And that's that ADHD flexibility that Sylvia was talking about, right? Like, which is like part of our goal is to be flexible enough to be inclusive, right? To respond appropriately to challenging situations. I find the best tools for that, as I said, is a personal mindfulness practice, and then continuing education to make sure I'm understanding different things that are happening out in the world, and how I might react to them. But my mindfulness practice is at the core of everything that I do and say in these settings, because without that, I'm not using conscious use of self, right? So conscious use of self is your number one tool, and it's the most effective tool that you have. So this final little offering for you is a blessing for healing, for healing ableism. So here we go. We'll try this one. Our ancestors in the Torah guide us, not despite their disabilities, but in part because of those differences. Moses had a speech disability and was appointed by God as the spokesperson for the enslaved people. His sister Miriam fell ill, and the whole camp of 600,000 people waited for her during her quarantine. King Saul suffered from deep despair, and David would soothe his soul with sweet music. Let us dream together of a time when all of our access needs are met with unconditional love. A future when each of our body minds will be celebrated and caring for each other will be sanctified. We will leave no one behind as we roll, limp, stim, sign, and create the living future that we all deserve. May it be so.
Amen.
Amen.
Well, thank you, Margo. That was wonderful. We really appreciate that. Anyone want to say some parting words or appreciation or anything?
This was wonderful. Thank you very much. I don't know if I learned any new vocabulary, but I really appreciated the compassion.
Would you guys like to put in the chat your email address, and I will send you the slides?
Well, why don't you send it to me, and I'll put it on the Rabbinic Pastor newsletter.
Okay. And I can also send it to you personally if you want me to. That's no big deal. It's just a slide deck. Okay.
Sure. Yeah.
Well, you have my email.
I did. And I will definitely, here we go, grab both of those. And
And you have Ellen's email probably.
I already have Ellen's email, so I'm good with that. And hang on, before we hang up, I'll just take a screen. Okay, thank you. All right.
I appreciate this, Margo, and
To you and to each of you. And it was really my delight. It was a small group, but I felt like in that way it was intimate and we were able to cover all the materials. So you'll have my email address as a result, and feel free to reach out in the future.
Really appreciate it.
Thank you so
so
much.
much.
thank you, Margo. Nice meeting you.
you.
Take care, everybody.
Bye.
Bye.